Today we are speaking with Dr. Stacey Nicholson. For those of you who don't know, Dr. Nicholson is Phoenix Children's physician-in-chief and oversees the entire specialty medical staff. Doctor, tell us a little bit about where you're coming from and your background and what led you up to your position here with Phoenix Children's.
Well, I am a native of Georgia. I grew up in a small town in North Georgia. I then went to college in South Carolina, a small liberal arts school, where I got a mathematics degree. I then went to my state medical school, Medical College of Georgia in Augusta, Georgia, completed medical school, and then went to Washington, D.C. I was in D.C. for 12 years at Children's National Medical Center, where I did my pediatric residency, my pediatric hematology oncology fellowship, and then I got interested in brain tumors during that time, and I stayed at Children's to be on staff as the clinical director of neuro-oncology. Then after 12 years I moved to Portland, Oregon, where I went to establish the pediatric brain tumor program there at Oregon Health and Science University. Did that, ran the cancer program there for a few years, and then for the last decade there I was the department chair of pediatrics and the physician-in-chief at Dormarket Children's Hospital. I came to Phoenix Children's because this is such a great institution.
Definitely.
With a great history, already known for great care. It's very young, but I knew it had so much potential, and I felt like I could really contribute to its achieving that potential. I'm just thrilled to be here. Everything that I thought about Phoenix Children's before I came is absolutely true. Great people, great institution,
Definitely.
Great facilities, and so much untapped potential that we can develop further and improve the care of kids here in Arizona. So I'm really happy to be here.
So I mentioned earlier that we were voted as one of the top hospitals in the nation by U.S. News and World Report. What are you doing with this organization to make sure that we stay in one of those top spots?
Well, let me say a few words about U.S. News and World Report first. When I first got involved with this survey and this ranking system at my previous institution, I thought it was all about marketing. It was just, let's get those badges and let's use them to tell our community how great we are. But I very quickly realized that this was about quality of care, and this was about having the right programs and comparing yourself to the very best places in the country. So we did do very well this year in U.S. News and World Report. We were ranked in 9 out of 10 specialties. We actually, for the first time, broke into the top 20, and we did that with 4 different programs. And so we were just thrilled with that. But that represents the fact that we're using that data, we're using that information, again, to compare ourselves in each of those programs to the first, second, third, fourth, and fifth best programs in the country. And most of these rankings are based on data. And so the patient outcomes, number of patients, what kind of programs do you have. And so we're using U.S. News and World Report to improve ourselves. So we can do analyses, find out where our gaps are in care, what programs do we need to develop to get into the top 10 and then stay there. And so for us, it's about quality of care and having the services that the kids of Arizona deserve. And if we take care of that, the rankings will take care of themselves.
Definitely, definitely. Sounds like a lot of work, but a great strategy. So let's fast forward a little bit. Tell us about the future. So what type of goals is Phoenix Children's setting up today to make us even better than where we are today?
Well, we're doing that really across the spectrum of pediatric health care. So in terms of what children's hospitals traditionally do and what Phoenix Children's has done so well for so many years, we're further developing our tertiary and quaternary highly specialized care capabilities. So within each of our programs, cardiology, cancer, gastroenterology, neurology, etc., we're not just focusing on the subspecialty, but diving down in each subspecialty and developing highly specialized programs. For example, in cancer, we have programs in neuro-oncology and leukemia and solid tumors. We have bone marrow transplantation. In the Heart Center, we have heart transplantation, we have heart failure, we have people who do interventional cardiology in the cath lab all day, and on and on. So we're developing those really highly specialized services in each of the subspecialties. But on the other end of the spectrum, Phoenix Children's is now a leader in population health. We have one of the best developed clinically integrated networks for children, the Phoenix Children's Care Network, in the country. So there we're working with community pediatricians across the valley to raise the bar for children's health care across the continuum, from completely well children to those who are highly ill and need a place like Phoenix Children's.
Wow, it's amazing. And I'm also hearing about the technological advances at Phoenix Children's as far as the imaging and the 3D printing. That sounds like that's going to be a huge step for us as well.
Well, there's never been, I think, a better time to be in medicine. The pace of scientific discovery is faster than ever before. So we now know the human genome, and so we're trying to harness that knowledge to improve children's health care, matching specific drugs to specific conditions in specific children. You mentioned 3D printing. We have a 3D printer in our heart center here, and so we're able to use that technology to print out models of the malformed hearts that our surgeons are going to operate on ahead of surgery for better surgical planning. So that's just one example that really a decade ago would have been unimaginable. So who knows what the next 20 years are going to hold.
It's an exciting time, just like you mentioned a few minutes ago. Well, Doctor, thank you very much for taking the time out of your busy schedule to meet with us and talk with us and to give us some insight into Phoenix Children's. I appreciate it.
Well, thank you very much, and I'm just thrilled to be here.
There you have it. That was Dr. Stacey Nicholson. We're also going to be bringing to you some more videos in the future with some more of the amazing individuals here at Phoenix Children's that make up this awesome organization.